We now talk to Treatment Czar and Health Undersecretary Leopoldo Vega. Good morning, sir. Thank you for taking our call.
Good morning, Ria, and good morning to all the listeners of CNN. Good
Now,
morning to all.
yes, sir. Now, it seemed for a couple of weeks there that the Philippines was able to stave off the Delta variant, but we now know that it is here. How concerned are you with the presence of the Delta variant in the country?
Yeah, definitely we're so concerned, especially with the health sector, since this Delta variant has been known to be very highly transmissible. And this is more than, I think, 40 to 60% than the ordinary variants of concern. And this is going to be a problem since if there is so much movement and there is no restrictions and no aggressive implementation of our prevention and detection and isolation, we will have problems in terms of the coming surge wherein hospitals and even the isolation facilities might be overwhelmed. So we're trying as much as possible to make sure that if ever the Delta variant comes in and they're already here, that we have really to strictly enforce the compliance of the prevention, detection, and isolation, and treatment, and of course the contact tracing. And on the health capacity side, I think it is always best, and we have learned our lessons even from the past last year and this last March, that we do have to consider putting in enough spaces for the infrastructure, like the putting up of the intensive care units or any allocated beds, especially in hospitals, and make sure also that we have the necessary services and the stuff, the medicines, and of course the mechanical ventilators around, and with the also, and lastly, the staff. That's the augmentation of the healthcare workers. So in other words, we have learned our lessons since last year and this past March, and we know how to effectively make sure that the hospitals will be able to capacitate themselves in the presence of a surge.
Right, so really preparing for the worst. And speaking of the worst, you see the nightmare scenarios in India, in Indonesia, and I think everybody's fear is that that could happen here in the Philippines. Do you think that that is possible, sir?
If we are not able to do the proper aggressive implementation, especially on the strategy of prevention and detection, isolation and tracing, then we will really have problems in terms of making this transmission as rampant as it could be. But if you are able to be very aggressive with the PDITR alone in prevention, detection, isolation, I think we have already an edge in terms of making sure that the variants won't take enough of the space, especially with the health capacity.
How much time, sir, would you say we have to avert a huge crisis like what we are seeing with our Asian neighbors?
So I think the only way that we can avert this crisis is make sure that we have a very good implementation down in the local government units. If you've seen that the Delta variants have been shown to be in the provinces, and I think it is in these areas that we need to calibrate the quarantine positions for leveling it up, making sure that there is not enough movement and essential workers are just around, just to make sure that the variant can transmit as much as possible. So that's the strategy really is for the local government units to do granular lockdowns and be aggressive, especially on the detection side.
Sir, we had the Vice President Lenny Robredo yesterday suggesting that the one-dose Johnson & Johnson vaccines be sent to the hotspots or the areas where Delta has been found. What's your reaction to that?
Yeah, I totally agree. I think the one-shot Johnson & Johnson is very significant in terms of allocating these vaccines down to the areas where there's a high risk or high risk classification that the Delta variants are there, and also in areas wherein there is a surge an uptick in terms of the number of new cases, and also in geographically isolated areas where it's not possible for a second dose for this vaccinees to go back to where they had their first dose. So in other words, this is a very significant one shot, and I think this will greatly enhance our vaccination.
Right, so really we want to contain the variant as much as possible, make sure it doesn't get to populated areas like Metro Manila. What do you think needs to be done in Metro Manila in order to be sure that the Delta variant does not spill over here?
Yeah, I think one of the things that still it should work, and it's been proven, is the use of mask, social distancing, indoor ventilation, and of course hygiene, washing of the hands. In other words, this strategy is really very helpful in making sure that the virus cannot transmit, because I think the virus actually it goes in a very linear behavior and looks for a host. So if we can prevent by masking the replication of this virus or transmission, then we are at edge in terms of cutting down the transmission. And of course, definitely we also have the testing and the contact tracing of those with positive. So even the contact tracing has to be a very aggressive, reaching up to the not just the second degree but the third degree that they were in contact with. I think with this kind of strategy, we will be able to contain the transmission of the virus. And the other thing is we also have to ramp up the vaccination, because we all know that this vaccination will create a wall of protection in the community. And I guess if we have a bigger number of vaccinations in the community, there would be a lesser transmission, although there are breakthrough transmissions, but it would be lesser and we can contain this virus.
All right. Maraming salamat, sir. That was Treatment Czar and Health Undersecretary Leopoldo Vega.